the southern region. Finally, we are in Blantyre, where Muuni Fund Pitch Program has come to interact and meet with the 32 innovators that will bring solutions for the different challenges that are faced here. Looking forward to seeing what they bring to the table. Is the innovation that will be brought here going to be the one that changes the face of Malawi? Introducing our judges for the Southern region. Dr. Michael Ziwa, lecturer, MUST. Dr. Patrick Chikumba, lecturer, MUBAS. Noah Zigoa, CEO, Institute of Chartered Accountants of Malawi, ICAM.
Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto kuza dziko lathu. Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto omwe amagwa mdziko lathu.
Kuchokera ku Balaka District Council tuzenzina hano komanso kuti tsiku ndi tsiku mumakhala mupanga chani mumwana.
Dzina langa ndi Elias Kaveta, ngakhale magulu ena amadziwa kuti Zinja. Tsiku ndi tsiku makamaka ndine opanga za ulimi ngati mulangizi. Komano mwina zaka zitatu zapitazi ndakhala kuti ndikupanga ngayi sukulu ndi simapanga ntchito ya ulangizi naye ndikupanga kafukufuku.
Ndiyeno kafukufuku amene muchita ku sukulu yonso ndi wa nkhani za ulimi zomwezo?
Naye ndithu wa za ulimi yamapita kalekale.
Ndiyeno pakadali pano mwabwera kuno ku Muuni tinene kuti mwabweretsa solution ya mtundu wanji kuti pakadali panopo ntchito ya ndu yobweretsa answers to the different problems that we have here in Malawi. Ndiyeno tikamaona za innovation ndi vuto inu mwabwera ndi za mtundu wanji.
So titaona pa ma challenges amene anapangidwa present ndi ma council osiyana-siyana, panali issue imene inatuka ku Balaka yokuti akufuna farmers communication hub. Makamaka kufuna kulumikizanitsa information ya malimidwe amakono, zinthu zina zofunikira ndi pakati pa alimi okhaokha komanso pakati pa alimi ndi akafukufuku ndi akuluakulu ena ogwira ntchito za ulimi. Ndi patapezeka vuto imeneyi inali kuti ine makhala kale ndikufufuza zinthu zina ndi zina zothandizira kuti zingathandize kupititsa patsogolo. Ndi taona kuti pakufunika ka innovation kachonchi zinangolumikizana bwino ndizo kuti mafufuza kalekalezo.
So yes, ngokumalizana, perfect timing. The opportunity meets preparedness in terms of the information that you already had. All right, zabwino zonse pamene mungabweretse maganizo anu kwa ma evaluators athu nawo.
Tangoganizirani Malawi amene alimi akakhakuda kumana ndi zophinja zokhuzana ndi kusintha kwa nyengo atangopita pa foni ndikuyang'ana zinthu zomwe angathe kuchita kwathandiza. Komanso pa nthawi yomweyo anthu amene akupanga implement ma program awo aja amene akugwira ntchito ndi alimi aja atha kutenga information yomwe ingathe kuwathandiza kupanga improve ma programs amene akupanga aja. Ndi pamene panabwerera innovation ya alimi acheze kwambiri ndikuti kuthandizira kuti alimi aphunzirepo zinthu zambiri komanso kwambiri kuthandizira interaction pakati pa alimi okhaokhawo. Koma most important mbali inaso ndikuti kuthandiziranso kuti pazitoledwa information yomwe izithandizira ma expert ma project designers kuti azipanga improve ma program awo. So iyi alimi acheze inachokera pa need yomwe inapezeka ku Balaka ya Balaka Communications Hub komanso ikuchokera ku research yachitika m'madera osiyanasiyana Malawi yomwe inakhala ngati yakumana pamodzi ndi ma ideas amene anakuchokera ku Balakawo. Kwambiri alimi acheze ikungothandizira kuti resilience ya alimi ikule makamaka alimi amene ang'onoang'ono amene timagwira nawo ntchito kwambiri ku Malawi kuno. Kwambiri innovation ithandizira kuti iphunzitse alimi kuphunzira ulimi wa makono omwe timachita climate smart agriculture. Komanso ithandizira kwambiri kuti anthu amene akupanga mapulogalamu azitha kupeza information yowathandizira kujaja ngati maupangiro amene akupereka kwa alimiyo akuthandiza kapena maupangiro amene akuperekawo ali ndi pamalo pamene pakuyenera kufunika kupangidwa improve. Komanso kudera limenelolo apapa ngangoti mwachidule ngati Balaka. Komanso ithandiza ubale pakati pa alimi okhaokha. Kwambiri kwake sindichedwa tingopita straight ku platform imene lili panakhala kuti mungathe kupisa ntchito link imeneyo mukanatha kulowapo ndikuonapo ma link awiri amenewo. Imodziyo ndi system platform yomwe izapanga manage information, koma inayonso ndi platform yo ikuoneka chonchi apa ndi pa landing page ya pa site ipo pamene tizakhale kuti tikulongosolapo nkhani zosiyanasiyana zomwe zikuthandizidwa kuchokera ku limeneyo. Pali pakepa pali zokhuzana ndi zambiri za platform yakuti kuthandiza chani, komanso information ina yomwe ingathandizire kuti anthu amene agwiritsa ntchito ayipezepo mphamvu adziwe zomwe zikuchitika pa platform imene. Koma kwambiri kwenikweni chomwe ndimafuna tionese apapa ndi chakuti pali magawo 4 amene alimi acheze izakhale kuthandizira. Kwambiri pali agriculture education hub yomwe izakhale kuphunzitsa alimi kuti aphunzire zinthu zosiyanasiyana zokhuzana ndi malimidwe komanso zokhuzana ndi zinthu zina zomwe zingathandizire mu ulimi wawo makamaka za misika. Komanso pali nkhani yomwe tikufuna kuthandizirapo kuti ulimi upite patsogolo. Monga ngati apapa pali mbali imene atha kutenga chithunzi cha matenda olo kapena kachirombo kamene kakuwavutitsa munda mwawo. Kachirombo kaja tikakajambula kapeze kuti kapangidwa recognize ndikupereka remedy kapena nkhani yokhuzana ndi matenda amene aja kuti atha kuthandizira kuti agwiritsa ntchito mankhwala anji kapena apangapo bwanji. Pali gawo lina lomwe ndi early warning system makamaka nthawi ino pamene timadandala kwambiri zakusintha kwa nyengo komanso ma floods, ma droughts. Mbali imene izakhale kupereka information yokhuzana ndi za nyengo kulengera kuti nthawi imene zikuchitika ndi yani komanso anthu angapangepo bwanji kuti zomwe zachitika zisapange impact makamaka kukhuzana ndi kumunda. Ndipo pali gawo lalikulu lomwe mwina kutengera ndi pamene anachokera innovation ndikuti kumanga mudzi wa alimi pamene alimi atha kukwanisa kupanga share ma experiences awo. Ndinakumana ndi vuto ili ndinapanga chonchi inu kumene kutipanga kodi izi tingapange bwanji, yomwe ili platform ina yomwe ingathandizire kuti ulimi upite patsogolo. Ndipitano pa system dashboard yake. Mene tikuonera munde kuti akakha kuti akugwiritsa ntchito alimi platform imene azakhala kuti akuziwa makamaka nkhani yokhuzana ndi za nyengo zomwe zikuchitika pamenepo. Komanso akalowetsa information yomwe tikutanthauza kuti kumbali imodzi zakhala kuthandizira anthu opanga maprogram kulenga information imeneja izathandizira kuti athe kudziwa kuti kodi za ulimi zawo za malonda zikuyenda bwanji yomwe izapasa graph. Komanso kwambiri system izakhalira tikuziwa kutenga ndi dera ndi nthawi ya chaka yomwe kuchitika. Izonesa kuti ngati ali ndi nkhuku akuyenera kupereka mwina mankhwala achitopa period iyi kapena kupereka akuyenera kupanga irrigation kapena kupanga weeding yomwe izapasa social. Komano kwambiri pazakhala mbali imene tikufuna kulumikiza ndi maagrodila ndi alimi kuti azidziwa zomwe zili pansika komanso kuti maagrodila ake ndi ati. Mbali ina ndiyo kuti alimi omweomwewo athandiziranso kuti azikapo information yokhuzana ndi zimenezi kuti atha kugulitsa. Pali mbali ya maphunziro yomwe pazakhaleno maphunziro osiyanasiyana okhuzana ndi agroforestry, conservation agriculture ndi zina za makono. Mbali ina yomwe timakamba yokuti atha kuziwa za matenda idzakhala pamene azatha kugwiritsa ntchito tsamba limeneli. Ikakhala lili pafoni moyona ioneka kuti ikaonetsa amene atha kutengera chithunzi ndi kupanga zimenezi. Komanso pali tsamba la mchezo lomwe tikutinso ndi gawo lalikulu kwambiri foti lithandizira kuti anthu aziphunzira kuma experiences a zomwe achitika, komanso thandizire kuti ma extension worker ndi alimi azitha kulumikizana pamodzi. Tikachoka pamenepo ndi kuti tilongosola kuti kodi ndi chifukwa chani tikuona kuti alimi acheze ndi unique approach to this to the innovation in agriculture. It's a game changer chifukwa chokuti it addresses my key challenges and amene alimi akumana nawo. My issues amene tikupanga address based on the research that yapangidwa conduct in different places including Balaka. So it's adaptable to different districts, not just Balaka, but also adaptable to different projects. At the same time, it can work with either lead farmers approach, which is an extension approach, or either it can work with farmer field schools or household farming systems. So it is adaptable in a number of ways, but the most important part is that it is the first innovation that attempts to track the adoption of climate smart practices, which has had a lot of investments over the years, but nobody can really provide information of this is the impact and this is where we're coming from and this is where we go. So this is a very unique challenge that has never been addressed with any type of innovation. In another way, it also fosters that co-creation of ideas, farmers and extension workers to create ideas together. And it coincides with the boom of young farmers in the country, which means that technology use and farming comes together and it has the chance of success. When I come to that point, I would like to thank you.
Thank you. Time?
Okay.
Yes, sir. Yes, that.
I'm still admiring the picture there, Chair.
Okay.
My next question was, are you a farmer? Something that
Yes.
poses more than
Yes,
a farmer.
I'm a farmer. I'm an agricultural extension worker, or a research and extension worker, in other words.
Chair, I think you have appreciated the demonstration of the prototype, the actual prototype itself. However, my understanding this should be a farmer's system, and therefore owned by the farmer itself. So the primary language I was anticipating was maybe Chewa. I don't know. Naturally, of course, you could develop it in English, but I think it's just a proposal that you migrate it as early as possible to a language that is common to a substantial number of farmers.
Yeah, actually, we already were studying, but we haven't finished because of the timing and we had a little bit of hiccup. But we've already started translating. But you know, in the development process, I think it was easier to develop in English and have all the functionalities and understand how it's working, and then come to a different phase where we translate everything because of the connection. So that is obviously in the plan.
Yeah, that is in the commission.
Yes.
But yes, it's a very good innovation, and I can see it to be, instead of the time that we had clouds, we were on time before you were born. But it's you are now bringing together in the community where there is that information sharing of farmers, even their experiences. It's a very good initiative. And I think what would just be key is the issue of language as put, where you are I think the way how we were going through, I think they were lost that okay. So here, on this page, where do I go? Maybe you were using a Sydney.
But I think maybe because you did not register and sign in, because you're supposed to register and sign in, that's part of like I was saying, the other part is going to collect information. So it's a must that you have to register certain details.
Alright. Now, I think what is key now is this system. Who will be the owner for the system? Who will ensure that the issue of the registration of the farmers has taken place? It means you will even go further apart from just that information sharing in terms of even the selling of their products you can be used.
Okay, so the idea was is still that it's adaptable to different projects. I mean, maybe you may be familiar with projects agriculture, how they're being implemented. Amakabudi, they are targeted to a certain, even within the district, they may target to a certain TA or certain villages that they're working in. So within that area, they usually have a programs officer or a project officer who manages that area. So depending on the type of project and their approach, so for instance, if they're targeting, let's say, 100 farmers only, they can actually have a list of all 100 farmers or even 200 within the system. They will collect that data. But if they're working through a different system, younger lead farmers, which is the most common one with and Aguma district agriculture. So it means that you can actually have the database of the lead farmers who will be uploading information on behalf of the rest of the farmers that they work with. So, and mainly the ones that are project managers at that level will be able to feed in the information for that specific area or for that specific district, depending on the different approaches that they're using. So usually it will be at that level, but then depending on the need of that information can be centrally now so that can used across the country. But in terms of ownership, like you're saying, I think it's mostly owned at that project management level. So whoever is trying to manage that will be responsible to gather the type of information to help them to follow the rest of the initiatives.
The source of my question was, here we are looking at working in a district council. In this case, are you going to sell the system to the district council, or you're going to manage it, or what will happen? Because we are looking at
okay. No,
how
well,
do you sustain it?
Okay. Well, so this system is going to be mostly it's going to be utilized at the council or even at NGO levels, but this is per scenario arrangement depending on what we are looking for. So for initially, like for myself, we're already looking at working with young farmers. So that means the system will own it and we manage it at pro bono. But when we're working with NGOs or maybe the council, then that means the council has to be able to buy those rights from the system to be able to utilize it.
Yes, thank you very much. Mine is the first thing on the login. We understand we have different types of farmers with different levels of literacy, and even the ICT adoption rates are different from one region to another, from one district to another. Do you have a number of options that people can use to log into your system?
Yeah, I think out of the options that are shown there, the one that actually we thought would be workable is the use of phone number than email and the Google links. But then we're still trying to adapt that. But I think the most option that we thought would work with farmers is to use my phone number instead of email and my Google links. Other option maybe may be explored if there would be any other ways to simplify it. But like we're saying that it's for the farmers to be able to use it, whichever is going to be the simplest way to help usability of the platform would be the one that would adopt. So that's an area that we are still exploring, though we are thinking of the phone numbers as to be the easiest.
Okay. What about the USSD? Assuming that maybe I don't have a smartphone, I cannot have access to the internet.
Well, that
But I am very keen to share some experience with my colleagues.
that would be a little bit challenging because, of course, that's something that we can explore, but it means good functionality or functions that and benefits that we will obtain from it would be limited if it is the USSD. But if they are using the app of this, they'll have more information in terms of multimedia and linkages. So it's a give and take. It can be certain information that can be provided on USSD, but then cannot be. It will be limited, in short. That's what I would think. But maybe there are other things that are being done that can help. That's something else that can be explored.
Okay. Yeah, thank you very much for your time. Thank you very much for your presentation. Interesting thing is that the presentation was in Chichewa. And we are trying to translate your English into Chichewa.
I was not now for listening and I'm going to go and was already in job section. But then offended. Yes,
Yeah, but it was very interesting. Yeah, since you're going to have multiple languages, with at least the adoption because of Kalabaya young Hambo. We wish you well. Indeed, that was
So Alimi Dijeze, Baraka District Council, what stood out for you with this innovation?
Yeah.
Thank you. At first, I think I have to commend areas for his innovation, his confidence of what he thinks that he can be delivered. And he also knows what are the challenges that farmers are facing. And he has a proposed solution which is also making sense. What is key is just to address some of those minor issues where language issues have to be delivered now. But otherwise, I can say that there is already a progress that is already making in terms of working this solution so that everyone can be able to use and understand it. So it's a good innovation at that level. It's a good innovation. It's so complicated, but it is something that can be utilized by a lot of farmers.
What of the climate smart practices aspect that has been added to this? I think so far we've heard of people having an idea of what's happening generally with the climate so that they can prepare themselves, but not deeply into the issue of the practices which are climate smart.
I don't know. So, climate smart is closely related with precision agriculture. You really need to understand the crops that you are handling, the environment that you are in, the kind of the soil that you're using, and the rainfall patterns, such that when you're indulging into that kind of agriculture, you understand the risks, and therefore you go for the crops that are not only resilient but also do match with what is expected in terms of rainfall and all that. So I think that's the kind of agriculture at the moment that we should be pushing for. looking at what we have just recently experienced, what prolonged dry patches in the middle of the rainy season. Those are indicators that maybe traditional approach to agriculture is phasing out. Yeah. So with the coming in, like the system that Gareta is developing, I think those are the tools that communities would need to guide them and help as they are migrating towards conversation.
I thank you. That's it. Be on the lookout for various giveaways during the airing of the Muuni Fund Pitch Program.
Well, my name is Ishmael Joanda, and I'm representing Machinga District Council. My area of intervention is the development of the levy payment system, an online payment system which eases the collection of the taxes and municipal fees.
Okay, what inspired this for you?
Well, when I heard about the Muuni Fund project, I was actually interested in knowing the intervention areas. So I am attracted to the banking and finance area because I once worked for Credit Data, which also is under the banking sector.
Mm-hmm. Now, when you looked at this area specifically, how much time did you put into just some of the research that took place for you to actually get to the place that you're at now?
Well, it didn't take much time because, as I said before, that I'm mainly interested in the banking sector because it's somewhere that I already have experience working in. So I was already motivated by the idea that I should contribute to something which I already have background.
Okay. Well, I wish you well. Good luck as you present your idea to the evaluators.
Thank you very much.
Awesome.
All right, good morning once again. My name is Ishmael Joanda, and I'm basically from Machinga. Today I'll be talking about the levy payment system. What is a levy payment system? This is a system that seeks to bridge a gap between the collection of municipal fees, taxes for the local councils in Malawi or other municipalities. There is a need for an introduction of a system which is going to tackle the collection of those taxes in the local councils. That's what a levy payment system is for. The system has features such as automated payments, tracking the payments, reporting the functionalities, and streamlining the collection of the levies to the government system. When we talk of the levy payment system, it has to be scalable in different platforms across the country. So I want to emphasize how the system is going to be unique and how it can be scaled across different platforms in the country. So a system wants to be a good system if it cannot be integrated with other systems, or if it cannot be deployed across different platforms in the country. So the levy payment system that we have developed is scalable across different platforms. It has continuous monitoring. We are also accepting feedbacks from users, which makes it unique. We are also ensuring that we're making it user-friendly to make sure that it is not very complicated for typical users. Any system that is very complicated and hard to use is very likely to fail, because people wouldn't want to pay taxes in cash, and they certainly wouldn't want to pay it on an online system which is very complicated. We're also looking at the interoperability of the system. This will not be the first system to be introduced in the country. It will be a child system among parent systems that are already existing out there. So there is a need to make sure that it is interoperable with other existing systems. So we have made sure that we have done a rigorous assessment of the system. Is it going to be compatible with the already existing systems? Government has already systems in place right now. Are we going to be able to connect our system to the already existing systems? We have also made sure that the system has integration which is easy.
We want to be able to integrate the system with the government systems that are already there. If we are to collect taxes, how are we going to send those taxes to the Treasury Department? Is it possible to integrate our system with the other system? The answer is yes. That's one of the features of the levy payment system. So by ensuring that there is an interoperability, there will be an enhancement in the collection of the levy across different platforms and across different regions in the country. We would also like to talk about the commercial viability. Is it commercially viable? Are we going to do or to attract any investment or to collect any revenue from that application? So I'll be looking at 3 areas. The first one is revenue generation. So how are we going to generate revenue out of the system? Yeah, by ensuring that we have transaction fees. When a levy payment is made, for example, someone is paying a municipal fee, are they going to pay some kind of transaction fees the way we do with the mobile wallets? That it can be one of the parts that can be considered as a source of revenue generation. We also have what we call subscription plans. Those people that have subscribed to the system should pay at least something to make sure that the system is sustainable in the long run. We also want to make sure that there is what we call value added to generate sustainable income. But what about investment attraction? Are investors going to be interested in the system? The answer is yes, but how? There is a need to showcase the application to the market to make sure that investors see what it can do and what it can bring on the table. It has unique features, it is scalable, it has realistic financial projections to attract investors. These are things that can make someone bring his money and invest in the system because they may be aware that there will be some profit to be generated out of the system. So to ensure also sustainable operation, we need to consider partnerships. Any company that is too obsessed in being monolithic is very likely to fail. Even big companies tend to enlist their company on the stock market to make sure that they generate income through different stakeholders. The same, by partnering with other stakeholders, the system can also bring more revenue to the table. The market demand is also one of the aspects that are very important in as far as the production of the prototype is concerned. We need to talk about the targeted solution. We have designed the system to make sure that it understands the business or the audience that it wants to address. What is our vision? What are our goals? Are our goals aligning with the 2063 agenda? If it is, then the system is in line with what is needed by the country. We also need to understand what the government and other agencies want, and also the demographics of the nation. Also, do we have problem-solving features? Yes. The system addresses user pain points identified through market research, such as simplifying payments, to make sure that it is not a hassle to make these payments, and also to make sure that there is what we call transparency and accountability. Much of the revenue by the government is lost because we know for a fact that there is a person who has to collect cash from there. So if we have registered vendors who are paying their fees through an online system, there will be some sort of accountability through the reports that are also generated. We need also to have what we call competitive edge. We need to make sure that there is our application stands out on the market. There are other systems there, but what makes our system unique? Well, we have mentioned so many features that we have incorporated in the application to make sure that it stands out on the market and becomes the best. Just like we have competition in other platforms, like social media platforms, we have Facebook, we have WhatsApp, but still more people are bringing more innovations to compete on the market. What makes the innovation unique? Well, it has some automated features. Like, for example, it automates the complex levy calculations, eliminating manual errors, while saving time. There is also seamless integration with the accounting software. There is also need for users to track payments and access reports. The system is also equipped with that. But there is also need for improved functionalities implemented to make it faster, transparent, and traceable. But user experience is also very important in as far as the success of any system is concerned. We have made sure that the system is intuitive and user-friendly. We have also made sure that the system has clear instructions to make sure that people don't go around 5 pages searching for one button. No. But there is also an overall satisfaction through the feedback that we have gotten from the users that tried the application locally, from where basically our friends that have been seeing us develop the prototype. But also, a system cannot be full if it does not address issues, ethical considerations, issues such as data privacy. We don't need to collect data that is not necessary. For example, you're developing a calculator and then you will say, allow the calculator to manage your phone calls. So that will be going out of the bounds. The same, our system is also addressing these ethical considerations. We have also security features to make sure that people's data is protected. Now, inside the application, the users will be welcomed on the homepage whereby they can sign in or open a new account if they are new to the system. They can also make a registration. They can look at the services and the taxes that they can pay, such as property rates. Maybe you want to erect a banner in the council, for example, you want the market. Maybe you want to open a butcher, you want to pay your fee there. You have an establishment such as a building, a shop. You can select the kind of payment that you want to make. We also have an about page whereby people can go and see what the application is all about. Then after selecting the service that they want to do, users can make payments using the payment method preferred to them. So, in conclusion, yes.
Thank you very much, Mr. Wanda. Yes, I can respond to the presentation.
Thank you, Chair. Unfortunately, I think most fighters went into highlighting the characteristics of a good system that we are looking for. We didn't have enough time to look at the prototype of the system itself. But nevertheless, Chair, I think there's another initiative taken by the City District Council under sponsorship of UNDP. We were working closely with the movers. I don't know if you are aware of that system and how the system you are proposing will complement that initiative.
Well, I hope that if we have two systems that are conflicting each other in the same country, there is a need for collaboration there. Yes. So that maybe myself.
The first question is, are you aware of that?
No, I am not aware of that system.
Thank you.
Yeah, okay. I think Mr. Ishmael Wanda, I would say, I think much of the time has indeed been spent on highlighting the benefits of how the system works. They are theoretical, but we would appreciate more if we had seen the prototype, seen how it works. Otherwise, there are indeed several other initiatives that the government is undertaking, of course, through different departments. Now, what I would want to understand is the compatibility between this system and the other systems that are being used for collecting levies, taxes, all that. How is it compatible to the rest of the system? Well, possibly you might have to demonstrate how it is compatible than me just talking. I want to see how is it compatible.
All right, unfortunately, my system has also issues. I've just had to borrow another laptop to make the presentation. I'm not on my machine here, that's my machine. So for the sake of demonstration, maybe I can use my machine.
Yeah.
But in
Still part of the time.
Yeah.
okay, but then I will have to make some sort of arrangements to be safe. Okay.
That's done.
Okay.
Just mind the time.
So this is the homepage of the system where the user can log in or sign up if they are new to the system. Then if they want to sign up, here they will be required to enter their details. They can find what they submit to the system. And also there is an about page here. But most importantly, the services that we're offering. So here, if you want to check the reminders that you have, maybe you want to register property tax, property rates, then you select that particular system, which gives you to check choose one. Okay. Let's say, for example, you want to pay property tax. Then after you choose the tax, it will lead you to the payment page. So here on the payment page, you're going to choose the payment method that you like. But then we haven't fully completed the payment process because we haven't gotten the payment gateways with the different companies such as Airtel, the banks, and whatever. So that would be the final.
Okay, so click on the proper tax where you say that it's going to lead us to.
Oh yeah, we haven't fully completed that.
So, okay. You're going to pay tax. Say income tax.
Yes.
Does it link you to the money pocket, for example?
Well, our key point here is to make sure that each and every property or maybe the income tax that you want to pay, it has to have some specifications. For example, if you want to pay tax for a particular building, it has to have specifications that building so much tax. There we need the payment gateway. There is a need also to connect with the MRI system so that when we deduct the money, it should be deposited to the correct account. So it's a work in progress. We haven't completed everything, but that's definitely what is needed.
Okay, if it is a property, the property will require the full information. It requires, say, the plot, the plot number, name, all that. All that was supposed to be part of the.
Definitely we didn't have much time to incorporate everything because even to get the information for the taxes that are needed, we had to travel to the council very late to give us the information that we needed. So there was a need for more information for us.
It's hard at the moment to appreciate the full potential of the system.
Yes.
I think we lost an opportunity because we focused on repeating the qualities of a good system. Almost went away from the template that we are using. As I said earlier, I think we should have appreciated going through the actual prototype and what is expected with the prototype. I think that's the only committee chair I can make it know now.
So far, who has been your favorite innovator? Drop their name in the comments below. Create, innovate, develop. Congratulations for making it. Please tell us your name and the council that you're representing today.
My name is Muuni, and I'm representing the Zomba District Council.
Okay. So what issue are you addressing in Zomba?
Basically, we're trying to digitalize the healthy passport book. So we are developing a system that will enable us to be storing data digital, electronically.
Okay. And just to backtrack a little bit, what do you do for a living?
Okay, first of all, I'm a student at Malawi University of Science and Technology. I'm actually pursuing chemical engineering. Yes.
Chemical engineering. That sounds very exciting.
Yeah.
So, how did you come from a person that's doing chemical engineering to find yourself looking at e books per se or
Yes, yes,
e health passports?
yeah. So basically, this is not my first project as well. I actually did this other project of the state of Tanzania together with my team, and I'm also pursuing another project that's specialized in building markets, working overseas. So I found myself in this, like let's say in this project of electronic medical records, simply because of my sister. My sister once went to the hospital and was prescribed wrong drugs. It took another doctor to after she lost the book. Another doctor had to come in and say, "You are taking wrong drugs." So to us as a family, it was bad. So just thought of jumping into this to solve that solution.
So, it's something that's close to home
Yeah,
for you.
it's very personal.
You know what? I wish you well when you get in there. Kill it,
Thank you so
make
much.
it happen. Looking forward to seeing how that goes.
My name is Muuni. I'm doing electronic medical record system. So basically, I'm just trying to digitalize this health book. In such a way that you can go to the hospital anytime without using the health book. You can just go there, access your data, and it works out fine. And usually, health books, it's prone to data maso, you lose data. So the first question that a person might ask, um, why is made necessary? Yes, it's necessary because one, the data is centralized and it's easier to access to patient records. The communication between the doctor and the patient, if it's easier because you're able to track the records. It also eliminates the fact that the digital passports can be lost, damaged, or stolen, or that records cannot be lost, damaged, or stolen. It eliminates the fact that you can't purchase the passports anymore. And it also validates prescriptions. And the reason why I'm doing this project is on this number point of doctor accountability. For example, I had a case back at home. My sister was once given wrong treatment and the solution got worse simply because the doctor that gave the prescription gave the wrong prescription, and because she lost the passport, she kept on drinking the very same medicine to the extent that it got worse until the other doctor treated her, but she wasn't getting well. And the doctor had asked the kind of medication that she was taking, and when they checked, they said according to the diagnosis and the medicine you're taking, they are wrong. So this also made doctors to be accountable to every information they write on the passport as well. What's special about MedLink? Someone asked. Number one, the system is simplified, the security of patient records, and it's time saving. For example, there are certain tests that you take blood group. Once you take those tests, like let's say on MedLink, the data will be preserved. So it's time saving and it really eliminates redundant tests. As I said, blood group, RAGs. Once you have that data, you don't need to be taking the test again. You are also saving income for taking those tests as well. You are able to track medical data over time, and this can be used to establish trends using AIs. The question might be who will pay for the system? The medical insurance companies, those guys, they need, before they get the client, they need the medical history of the person to know if the person is viable for their business. Subscription for having private health cares and health care providers, and also use of statistics by research institutions, e.g., View and Marine that gets Malawi River Trust, And then there is the issue of healthcare intelligence, as well as my employees who work anywhere. Yes. What's my future plans? The future plans is in terms of we want to have partnership, like how can we scale partnership with other international hospitals, for example, for referrals in India or South Africa, to the extent that maybe somebody has been sent to go to India. We can just, through our partnership, we can even send their data to check their records as well. We also want to have a centralized database, for example, in one place where we can operate all the hospitals in Southern region as well. System integration. It can run on Android, iOS, Windows, macOS, Linux. You can even work offline and synchronize later when connection is available. And another important aspect of it is you only use, or the user experience. Let me just take you to the prototype. This is the prototype. This is the prototype. Once you enter to meet the doctor, it will give you two options. It's either you can use your fingerprint to access your data, or you can use your national ID to access your data. Let's say when you want to have one-on-one conversation with the doctor. So once you enter your data, it will show your records. Like for example, you on 2024, month of 2, you had malaria and you are prescribed to have La 100 milligrams. So this data will be preserved. And on the issue that I talked about the basic information like there. We have the blood group A plus. Those data will always be there. And it can also help in terms of emergencies. Think about it. Let's say a person is losing blood. Instead of doing tests to find out the blood group, to perform transfusion, you just have to use a fingerprint and then they'll get that information and do the transfusion within the ambulance system as well. We have a section, this section where all the data, let's say that has been taken during the day, it may be recorded. For example, in terms of malaria, let's say in southern region, malaria in January, it has been registered that it was 10 people who suffered from malaria, and then you can see the trend, and then that data can be used by research institutions to say why are people getting infected by malaria in the month of April. For example, another example you can say COVID as well. You can say why January is being registered as having a lot of number of people registered for COVID as well. So this data can be collected through the very same process immediately in its instant. We have Korea as well. Yeah. So another point that I wanted to emphasize is this application is quicker. Remember the incident that happened last time for Marymount girls who were traveling to school, their bus had to crash. So they were almost like hundreds of students. Now the accident happened once. That means if they are to be taken to the hospital, our system, the way it is designed, it wouldn't accommodate all of them to be treated at once. As a result, it may end up leaving other students who could have been treated earlier, getting injuries that are so excessive. So this system, once you press your data, instead of conducting a lot of tests, once you press your data with your fingerprint, it shows your basic data and the treatment can be quicker as well. And I love one thing that I love personally about the system is on the part of healthcare intelligence. With this system, with the statistics that I've shown, it makes sure, let's say for example, in Southern region, it makes sure a lot of people are suffering from a certain disease so much compared to other districts. That means if the government is to purchase drugs and distribute them, they will prefer to send more in the areas where the trends are showing more of the diseases as well. In terms of security, what we are planning to do, once the system is established and it's good to go, we'll hire experts to find loopholes in the system, and we will also employ some security guys as well. Personally, I believe this is the future. Personally, I believe. I once fall a victim of this as well. I've seen literally my sister taking drugs that are not even necessary, and the doctor is not even accountable to it. Imagine if we have that system where doctors will be accountable to say those careless doctors to say if their data is there, they committed a certain drugs as well. Those guys can be accountable. They can take their job seriously. People can be treated well. And the doctors are ready as well. It's very good. So it's clear it's reading on the computer as well. Seconds.
Thank you very much, Mr. Muuni Masu, for your presentation and demonstration of the prototype. We understand that it's true. In the health sector, we need the innovations, particularly on the patient data management. Because people are mobile, they can go to one hospital, go to another hospital, they can meet different doctors. So these people need to share the information of that particular patient. So they can be very helpful. So we have a few questions. The first question is about your consultation with the. I don't know whether you have done a consultation of what is happening in the health sector in terms of patient data results.
Yes, that is
Did you have any background information of what is happening now and how your system is going to be integrated with the already existing systems in the health sector, and what areas are we trying to improve from your innovation?
Actually, that's a good question. When I was doing my research, actually, I was a bit disappointed. The only time that data is needed is needed in hospitals. Like let's say, for example, it's only needed when they are trying to do research. For example, they would send people for surveys, let's say to an institution to collect data. So at hospital, basically, I believe you've ever visited a hospital, you get your notebook, the doctor writes, they say the symptoms, you go for a test, and then once they write the test results, it's either if there is a person to do a survey in that area, it's there to correct the data in an Excel sheet. Okay, today we have registered this number in an Excel sheet, which can easily be manipulated as well. So that's what's there on the cloud actually. Yes, that's what's there on the cloud as well. Excel sheet, which can be manipulated. So when we hear situations like Sanjay has registered COVID-19 patients, it's actually there is a person who is there writing, we have registered. Once the person is done, there is no registration. It's like they just lay on you on this and then they go. They take it serious when the person is money is involved, like they're doing a survey. That's what it's but that's on the cloud. But this system, what will basically do is it will always be working, collecting data throughout. Easier and yeah, I think that's the best way to answer that question.
Yes.
Yeah, Chair, I don't know if the innovator is expecting a true picture there, but there are no systems in the health sector.
You know it's correct.
There have been a number of initiatives.
Yeah.
I was expecting maybe you would have highlighted what exists and where the gaps are. But my question is on the data itself. What are the mechanisms for ensuring the privacy, security, and integrity of the data? Data is really sensitive.
Yeah.
So your system should really have clear mechanisms of that.
Okay. That's one of the questions that has been bothering me as well when I was developing this issue as well. So, um, the first, as much as this is going to be a painful fact, but the first thing is that whatever system it's out there, it's always prone to attacks. We have a case at the issue to do with Ujama visa, which it has been hacked as well. So it's always prone to attacks. But one of the mechanisms that we believe in our system can be can be in it's safe as well. One being in most of the time when you develop an app, you hire experts, not just one. We can hire, let's say, from Malawi, those who are experts. We can even hire those who are abroad to check for loopholes. Those are the people that we tell them this is the system that we have developed. We want you to check in the loopholes. Once they check into the loopholes, if they find any, they write, and then you improve on that as well. But if I'm to say, I have developed a system and it's 100% safe, I would lie. So we rely on external people to check our system as well. And the people that we are going to employ, they are specifically cybersecurity employees. And another special mechanism that we have put in place, usually this data usually it's prone to attack when it's online. It's online, like maybe you're using a web page and it's always online, no. But then one of these trigger things that we have put is the system will be able to work offline, but for us to access the data, it's we can synchronize it later at our special time, like let's say this time, let's say today Monday, we choose the data will be uploaded, let's say it's 4 o'clock. The other day will not use 4 o'clock as well. We use another time. So if the person was expecting to hack our system, let's say when the system is online, Lori Samazai plays it. Basically, that's what you're thinking, right? And if you have a suggestion as well,
Will that compromise availability of the system? It's like you are saying it will be active online on specific times.
Yes. No, it wouldn't. It's like it still work offline, the system that still works offline. But then when we want to upload the data, for us to the central, the one that I said central database, we use a specific time. Yes. But if you have any suggestions that you can make on, you can also recommend us.
Thank you very much.
Yes. Mr. Menat Nyasulu.
Yes.
Thank you so much for this innovation. It's really very important for Malawi to have something like this. But I just want to find out from you if you are aware of a system that Look International, that was working together with Elizabeth Blazer Pediatric AIDS Foundation.
Can you come again?
I was saying, I just want to find out from you if you are aware of a project that was done by Look International together with Elizabeth Blazer Pediatric AIDS Foundation on the same electronic records, and it was deployed in several hospitals. I think the first hospitals that were deployed were Mzuzu, Rumpi, as well as in Kadabe. So firstly, I think that's the question. Are you aware of that? If you are aware, then what are the differences between that system, which is being referred to as a National Electronic Medical Records System, different from this one?
Okay. Thank you for the question. On the first part, on Look International, I wasn't aware actually, right? I wasn't aware, but I'll look into it. but there is always room for partnership as well. And to answer the other question is, I believe maybe let's say in this room, I believe maybe 90% are not even aware of the system as well. So basically, the people that are going to access the system, they are limited in those regions as well. Had it been it was throughout the whole Malawi, everybody could have known it. But I believe this one specifically, it will be visible to everybody. But I'll look into international.
Yes.
Yeah.
And in addition to that, just Claire said, who will be paying for this system?
Okay. According to the survey that we have done on how to operate the system, it doesn't need much. As much as it sounds complex, as much as it sounds it's a lot, but it doesn't need that much. That I can assure you. Let's say just the partnership with the medical insurance companies, just us partnering with them as well, or for them just to pay, even just the healthcare intelligence or use of statistics, that would be enough to operate it. It's just that these days people are too greedy. They want to source from a lot of funds. But if we can just use the statistics alone to sell that information, it can learn and it can even put subsidy on the Malawian people. It says that this one says that 300 kwacha. If you tell Malawian pay 50 kwacha the whole year, I believe everybody will be winning because we know we have other source of funds.
Thank you. On the MedRec, which is the electronic records for medical, it is very good if it is adopted in all the regions of Malawi. However, we understand that there are several initiatives that have been undertaken, but I think maybe what is lacking at the moment is the rolling out of the national system. But the system that was undertaken, it was looking at the whole nation. So it is something that's going to help, but there are just things to be looked at in terms of the security and safety of the patient's data. That is very key, especially on the accessibility and on the use as well. We have seen several other medical practitioners that have abused information, and we believe that there should be some controls on how the information shall be used. Thank you.
Kodi mukutipo bwanji zama innovation amene takuonetsani lero? Tuzeni maganizo anu m'makomenti musimu. Tuona nanso mawa.
Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto kuza dziko lathu. Muuni Fund is here. Yafika. Muuni Fund is here. Yafika. Kuthandiza Malawi tipeze njira zotana ndi mavuto omwe amagwa mdziko lathu.